The rehabilitation department of the Queen Elizabeth Hospital has been seeing patients around the clock. People seeking treatment include those who've had strokes, falls, car accidents, and shootings. Senior physiotherapist Dr. Jerry Warner says some people who refuse to manage conditions end up with strokes.
Severity of stroke in our younger population, especially our males. We have a number of persons who are not aware of their medical status. They don't know that they're hypertensive, they don't know that they're diabetic, they have not gone to the doctor. Some of them who do go to the doctor then don't take their medications. We are aware of some of the reasons why they don't take their medications, especially for the males. It can have an effect on certain activities in their lives, but the cause of the effect of not taking your medication is that you could lose function of one side of your body. You can lose the ability to speak. These are some of the sequelae of stroke. So we want to really encourage persons to embrace the lifestyle changes that are discussed with you by your doctors, by your nurses, by the Diabetic Association, the Heart and Stroke Foundation, all of these various entities, the blurbs that you hear on CBC, Q100 FM, all the various entities that give you information on your health. Please adhere to it.
Dr. Alicia Graves explains how the department functions.
Our physio team are divided into an outpatient team and an inpatient team. The inpatient team are the therapists who would actually deal with the patients who are in the hospital at that present time. The outpatient team, they're the ones who deal with the wide cross-section of referrals and patients that come through the physiotherapy department as outpatients. They come, they get their treatment, they leave. With the inpatient team, we treat the patients who are on the ward. So that varies from our orthopedic conditions, our cardiopulmonary conditions, our strokes, kids, elderly. We see everyone.
Dr. Warner says they have to do a range of assessments to determine whether patients will need a wheelchair or a walking stick.
If it's higher up in the cervical region or the neck region, sadly, that person might be a quadriplegic. All four limbs are paralyzed. Wow. And that person will require a lot more help. Initially then, our job will be to make sure that they're able to keep a chest clear, because once you don't have the thoracic nerves innervated, you can't cough. You can't do the normal things that you would do to keep your chest clear. Initially, once we get them past that, then it's specialized treatment along with the occupational therapist for specialized type of wheelchair, maybe examine the home to see what can be done to help them survive, and educate the family members as to their care.
The doctors also spoke to the need for diabetics to wear appropriate footwear to avoid injury, as well as the use of correct walking aids such as walkers and canes. Wendy Burke, CBC News.